All right. Well, welcome back, everyone, to another episode of the Health Made Simple show. I am here with our host, Dr. Bart Precourt, who has been a healthcare practitioner for over 20 years, practicing a range of modalities, including chiropractic, acupuncture, kinesiology, functional nutrition and supplementation, and lab testing, all out of his clinic, Balance Health Studio in Seagrove Beach, Florida, as well as virtually all around the world. So he's also the founder of the Health Edge program, which is a cutting-edge health program for entrepreneurs and executives wanting to take their health to the next level. He's working with celebrities and athletes all around the world. And tonight we're going to kick off with your clinical insight of the week.
Yeah. So my clinical insight is, again, a little bit of an aha moment. So when I'm in clinic, it's often, we're pretty busy. So, goes back to back. And I like to work in that environment. It really works best for me. It keeps me in my flow state, which is nice. So, it's hard to really explain, but that is the best state for a lot of practitioners when we're just in our flow. And then sometimes in that flow, I don't have a lot of room to soften things too much. So today, what I learned, my clinical insight was that sometimes some good old fashioned straight talk is the way it goes. And that, and when it comes from a direction of, and it comes from a place of love, that, and intentionally, I'm saying this to support and serve you. The impact is incredible. And I think I'm a little guilty, and maybe we all are, of not giving enough straight talk because we're so concerned of the emotions and the feelings of others because we become a little sensitive over the years. So in this particular scenario, and I'll give you the backdrop on this. This couple was in the office, and I've been seeing them for a long time, and I love them. They're a bit older, and they were having some questions. They're about to do some travel. They're vaccinated. They've been boosted. They got a couple vax shots, and then they got their boosters, and they're about to travel. And they said, well, I think we should be good, with the Omicron because of, all the stuff. And I didn't have a long time to give a long explanation. So I said, no, you got to let go of that train of thought right now, because you're not protected right now. You have just as much chance as anyone that's unvaccinated and spreading and passing it. And I'm truly, it had nothing to do with the vaccines. I just wanted them to be safe, quite frankly. And they're going to a family event where there's a newborn. And so there's gonna be a lot of people around, and they're in their 70s. And it was in that moment that they both kind of gave me that look of just like, man. And she was saying, this is such a bummer. And she's like, I kind of knew it. I just didn't want to realize it, and because we've done everything right. And I get that. Again, I wish that was the case. I wish we could just there was one thing, but the one thing is that we got to build ourselves up, get stronger, and be smart. And so it was that straight talk that I think got her to be like, okay, because then immediately she was then, what do I need to do? I'm headed off to Texas. What do I need to do? And that's the beautiful response right there. And if I didn't straight shoot that,
that's a much more empowering position, right? What do I need to do? What, yeah. For sure.
And then of course, I gave her the protocol, that we're using, right now for Omicron, which is a little bit different. There's been some different, I think in the last couple of weeks, maybe just 3-4 weeks ago, I think we were here on the show, and I was saying, listen, if you get the Delta variant, one of the best things that you can do is get the monoclonal antibodies, use some Ivamectin and Hydrochloroquine. And that has seemed like the best formula for this variant. That doesn't seem necessarily to be the case, at least not for the monoclonal antibodies. And remember, everything's moving so fast here. And here's the good news. This Omicron really appears to be about a 12-hour onset, 24 to 48 hours of potentially being symptomatic and uncomfortable, and then into recovery. And really quickly, it looks like we're looking at congestion, potential headache. Throat seems to be a big part of it, like a sore throat, like someone's, scratching your throat with razor blades kind of thing. And then fever. not really, really bad fever, but like the kind of fever that you might have overnight. So if that's your symptoms, that most of us would quite frankly consider in any other normal year, we'd consider a head cold.
Yeah.
We wouldn't think much about it because it's not completely wiping us out. I don't see not as much affecting the lungs, not as much, affecting other systems or symptoms in the body, but those straightforward, Karen. And then I see a lot of people anywhere from like overnight to 2 days, then maybe needing some recovery depending on how they dealt with it because they didn't really think it was a big deal. So those, and I'm really optimistic about this. And I say that because here's what I was saying to people all day long, that if they said, oh, I'm going to travel, I say, listen, just keep in mind, everybody, this, in my opinion, this time around, everyone's getting Omicron.
Yeah.
Yeah. And we're in any situation or scenario where if the virus is introduced in the original form, the novel virus, it's going to go through this sweeping change as well. It's just a matter of time. Anyone that's dealt with, listen, you don't need to be a virologist to understand this. Viruses, they create variants. They get weaker typically, but they become more contagious, and that's their attempt to survive. And I think right here in the States, I'm going to go as far as saying I think that this may be the thing that brings us all to herd immunity, what we've been talking about for a couple of years now, like it or not. And I think that there's some really positive signs that people are not going to the hospital and people are not dying. And that's what I mean by, so I think it's positive in the sense that everyone's getting it. It's in our section of Florida here. It is swept through in the last 2.5 weeks. Restaurants have closed because their staff is out and all that kind of stuff. And I think we'll probably have about another 1.5 to 2 weeks. It'll probably kind of leave this area. I don't know how it does that, but that's kind of my guess. And then you'll just see it taper off, but then you'll see another community, it'll blow up, and we see patches all over the country. And then eventually there'll be some level of herd immunity. Well, since we're on this topic, there's a protocol. What is the protocol then? Yeah, there's a protocol. So I should have brought it up.
Monoclonal antibodies aren't working so well.
Yeah. So the good news is this is all at home. And if for the people that are listening here that have put together or listened to our home remedy, like our what would we call that? Our home medicine cabinet, your healthy medicine cabinet. There's a couple key things in that medicine cabinet you want. The number one thing for this is your ability to defend when that fever comes, to let that fever do its job, but also to be defending the body. And the best thing for that, so number one is something called calcium lactate powder. Okay. It is calcium. It's a very ionizable source of calcium. And this is important, Karen, so we can absorb it very easy up into the body and also into the tissue. If we can get calcium back into the tissue, the body will not be in pain and discomfort. Some people have a fever and they check or they look at their Oura ring results and they'll have a fever and it's not that bad. That fever maintains a long enough time in the body, and then it starts to absorb and essentially use up the resources it has of calcium. But we use that calcium lactate powder, 1 tablespoon, with an electrolyte that we also had on this show called Hydrate. People can go on to like Amazon and find it's called Hydrate by Good Anya. We have it in our studio if people are local, but if you're not local, you could get it there. One of our friends out in California makes it. It's phenomenal. So listen, when your body's in a fight, one of the most important things is make sure that you have the electrical activity to continue to fight. So in the event that you give electrolytes to your body in the middle of a fight, you are resupplying your body. You're waking up your system. This isn't even building an immune response. This is just making sure you don't break down. And this is often lost because we're always thinking about like vitamin C, D, and zinc, which is all good, and all these other immune modulators. Yet at the end of the day, the very first thing that we need is a system that is firing properly. And if we run out of our electrolytes, sodium, potassium, magnesium, and any of those for that matter, chloride. If you run out of those, then the body is going to be super, super vulnerable. So we use those two things, mix them together, tablespoon of the calcium lactate and a tablespoon of the Hydrate, which is an electrolyte drink, about 20 ounces of water. Do that twice a day. Phenomenal right there. Many of my peeps, that's all they've done, and that's worked.
Okay.
Yeah,
Amazing.
so that's phenomenal. Now, the zinc and the D, absolutely, we're going to maintain them. They don't have to get ridiculous, but make sure if you're doing the vitamin D, recommend at least 5,000 IUs during this phase of like symptoms, and you're feeling like, well, I might have something. I might have a head cold, but this might be the boogly woogly here. So you're going to bump that somewhere between 5 and 10,000 IUs. The zinc, you'll keep between 50 and 100. Well, I want to talk about zinc a little bit later tonight, just because we can overdo it in zinc, but we'll keep that between 50 milligrams and 100 milligrams. And then here's the kicker. It's the C. If you're using the stuff that I typically recommend, something called Cataplex C, about 15 tablets a day.
Yeah. Okay.
If you're over 150, 170 pounds, go to 20 tablets. Now, inevitably, because this happened today.
Yeah. Wow.
Yeah. All right. And so people are like, whoa, my goodness, that's so many. But listen, we're talking about a virus that has shut down the world. It's not that many. And here's why it's so important. And hear me close when I say this. Everyone listen to this. If you don't get infected, you can't die. If you don't get infected, you can't die. And vitamin C stops infection.
Okay.
And I think I've just forgotten to say that out loud enough times so people realize how important vitamin C is for the human body. When you have COVID, when you have pneumonia, if it does not turn into infection, you do not die, period. Yeah. The infection is what kills us. The number one thing for the body to fight the infection is vitamin C and calcium.
Yeah.
So this one right now, just load up on it. Vitamin C is water soluble, which also means by the morning time, you're going to pee it all out and game starts again.
Very hard to overdose, right?
Yeah, we're not going to overdose in it. So, sometimes you go to a, get an IV in for certain, situations under guidance and stuff. You might do 100,000 milligrams in one single setting. Yeah. So the body can handle a lot of vitamin C, especially the source that I'm recommending, which is called Cataplex C, because it's a whole food source, Karen.
Yeah.
And therefore, there's always a safety behind that.
We've got a question here. Where do people find a doctor who will prescribe Ivamectin and Hydrochloroquine?
Yeah, there are definitely spaces and places. I'll see if where I just had someone post that to my website. No, not to my website, but to me. I tell you what, you can, I don't even know if you can Google it. I think you need to find it.
Yeah.
Karen, I'm going to see if we can't get that to our audience. Keep asking that question.
Here, FLCCC. Do you know what that is?
There we go. That's probably the frontline doctors. That might be the frontline. That's my good friend Kelly, who's a practitioner as well. So whatever she just said, there.
Okay. The FLCCC, Frontline Critical Care.
Yeah. Frontline critical care. Yeah. So, and I think you could do that, and they'll set you up in like a telemed situation, which is phenomenal. It's absolutely fantastic. Yeah.
Okay, cool.
Now the other two things that I would suggest for especially a lot of our audience tonight, because a lot of the people here have used turmeric before. Yeah. So during this time, load up on the turmeric. That still is a natural anti-inflammatory for the body. Yeah. So let's just say you cannot get your hands on Ivamectin, you cannot get your hands on hydroxychloroquine. So it's still an option. Yeah, you're in Australia. And listen, Karen, it's hard here too. Like maybe Florida's probably the easiest, and there's definitely access, yet it hasn't been easy because the practitioners that provide it are under a lot of scrutiny. It's a bummer. In a lot. So the ones that are doing it under scrutiny, then there's another group that are just kind of, I don't know if they're afraid or cowardly, or I don't even know what to call it. They're just not doing it. Nobody locally that I know of is providing it here, and that's here in our community. So, but it's definitely available out there. So it's the calcium lactate powder, it's the electrolyte. Don't underestimate how powerful electrolytes can be when you are in a fever, when you are fighting a virus. So make sure we get that in there. The CD and zinc, of course. Turmeric. If you're using the ones that I have called Turmeric Forte, I go pretty heavy dose here. I go 9 a day. There's a little yellow pills. That's a really strong, very bioavailable type of turmeric, crosses the blood-brain barrier. It's bound to something called fenugreek, literally the best source of turmeric for the body that I know of in terms of getting it back up into the tissues, especially, that's where a lot of the inflammation and discomfort come from. And then one more herb, something called Angiographis. Wow. The Angiographis complex has 3 of probably, the best, herbal supports for the immune system. It's Angiographis herb, it's echinacea, and holy basil. Super fast acting, and they're modulators for the immune system. Means if it's overreacting, it helps it calms it down. If it's underreacting, it helps it boost up. So we've had a lot of success with those things there. And I know it seems like a lot, but yet I tell you what, it wouldn't surprise me if half the people listening tonight have those on their shelf. They should. In your home medicine cabinet, you should have calcium lactate always, and you should have Angiographis always. So that's 2 of the group that I just mentioned there. So I feel real confident again that this is something that we can handle. And that is so important because it takes the fear. Remember, we've been in fear. The reason we're in a pandemic, the reason we have this mass formation psychosis, that's a borrowed term right there, but it is because of fear. And fear gets people to do funny things. We stop critically thinking. We stop thinking about what can I do? So when I heard that today, I was like, yeah, like that's music to my ears. What can I do? What else do I need to do? Not how many pills is that? Or how hard do I have to work? Or, how early do I have to go to bed? Yeah. What can I do? It's a great question. I think we just found our question for the end of the night too.
Yeah. What can I do? And, when we are thinking about taking lots of supplements, I mean, compare that to, taking antibiotics or something. It's way better to have to take a whole handful of supplements than do something like that to your body.
Yeah, it is. And I think that, that gets lost in it all too, Karen. So, and so inevitably today I had some people say, well, I had Omicron over the weekend and my doc, sent me in a prescription for these antibiotics. I'm like, oh yeah, man. So listen, I still think it's important that we're asking, well, what does that do? What's
for
that going to
do?
Yeah. So listen, I'm not just
for a virus.
Yeah. So antibiotics for bacteria. They're for bacteria. And I know that there are some protocols out there by doctors that have given them and said, man, in this event, and they're using them for different reasons, but not necessarily for some of the things we're seeing with Omicron. They were using them to make sure that we didn't get bacterial infections when our immune system was so beat up by the viruses. And I say that because it's not for free that you get to take an antibiotic. You're going to damage your microbiome. You're going to damage your gut flora. And it seems so innocent, and it doesn't hurt. It's not like someone walks up to you and punches you in the head. You take an antibiotic, no big deal. But then over the next 4 to 8 weeks, your digestion changes. You start to find yourself unable to digest meats and fats quite as good because your microbiome and your pH is off. Yeah. And next thing you know, you're a carb junkie. And then your bad bacteria, which is like the little funguses and molds and parasites, are just begging you to eat sugar and carbs all day long. So that's what happens when we innocently take, well, I just had to take it. So again, that's opening up our minds and asking the question. So like, I think it's important that we're starting to ask more and more questions. And that's one of the reasons I'm so optimistic about this upcoming year. It's going to be one of the questions we answer tonight, that I think people are, go ahead.
Yeah. Before we move that though, the supplement protocols that you just talked about, if you're not having any symptoms, but did test positive for COVID, do you still recommend taking all of them?
Yeah, I would. And because listen, if you did that protocol I just gave you right there, you'd level up your health. And this is really,
it's not
really
going to hurt you. It's only improving your immune system and your body in general. It's not going to make your body worse.
Yeah. differentiating this is really important for us all to step back and hear what I'm going to kind of explain here. If you did everything I just said and you took this, you'll actually be healthier. But it's not about your symptom. It's actually not about the system disease, that the dysfunction. It's all about the dysfunction, but it's not about the virus per se. But if you just walk up and give, 10 healthy people antibiotics, are they going to be healthier? No. Like they may kill off some stuff, sure, but they're going to kill the good guys as well. And that's the kind of thinking that we need to involve. And listen, you guys have heard me here. Like, I'm not anti-medicine, but I am definitely pro-thinking here. Like, it's time for us to really start to do a little more deep dive. And I'm probably singing to the choir to most of the people that are here tonight, or they're going to listen to this in replay, because you're doing a deep dive. You're trying to find more and more avenues for you to continue to level up. And I think, and kudos to everyone that's doing it, because that's how it happens, one little seed at a time. But it is the mindset, the frame of mind that we approach these types of decisions when it comes to our health. And nobody wants to be uncomfortable. Yet if we have strategies prior, when we are uncomfortable, then we can say, all right, well, I had a strategy. This was my plan. I'm going to put it into action. Yeah. But in the middle of being uncomfortable, very difficult. That's when we get a little more vulnerable to make some poor decisions. I'll take anything to make this go away right now. Yeah. Next thing you know, we're down a rabbit hole. So could you take these? And if you do test positive, yes, do it. And I'm not even going to bring up the fact that I still think that the testing policy, the testing procedures, these at-home tests, I think it's literally flip a coin. So I'm encouraging people, you got a head cold, you got a little stuffiness, whatever it may be, get on this protocol, level yourself up. You probably have to do it on that level for about 5, 6, 7, 8 days. And that's about it.
Okay. Yeah. Well, as you kind of alluded to, I mean, one of the questions we got asked this week was, about something you mentioned in the last show, when you were saying you're optimistic about this year, about 2022, or maybe you said it last year. So why are you optimistic about this year?
Yeah. And I know. And after I said that, I saw that question come through, and it's not that I'm super optimistic, because I think next year is going to be an easy year, not by the least. I think that next year now. This year, right now, 2022, what I'm optimistic about, and the reason I think it's going to be a good year, because I think that more and more people are willing to ask that question of what I need to do. Not I'm going to wait to hear what to do. Not tell me what to do next. Literally, what do I need to do to live the best and fullest life, the best and fullest life that I possibly can? And Karen, I want, this is going to sound crazy, but I think justifiably, Joe Rogan and his podcast has played a significant role in that.
Yeah, crazy. Yeah, he's had a lot of listens, a lot of ears,
a lot of ears.
Podcast. Yeah,
and it's just providing information. It's providing provocative thought that is waking people up to say, all right, let me just think about this one for a second here. And and it's so that is one of the reasons I'm very optimistic. I say that I think that we have the opportunity to move back in the direction where we don't have an entire nation / world that is fearful and uncertain. Yeah. And it is the uncertainty that I think we'll be moving away from, because once we start to ask the question, what can I do? Yeah. The certainty follows that, and certainty leads to action, and action is medicine. Yeah, we have to take action, right? If we sit there and just be scared, we're not getting any further. Yeah, literally, I think action is one of the best forms of medicine. It should be in the dictionary, and the Moreland's Medical Dictionary, the best form of medicine, action.
Yeah, for sure. And also I think, as more people are listening to things like that, that maybe they're more open to having discussions as well. One of the things that's been hard is if families are divided, or people do have different points of view, so it's good if we're able to open discussions a little bit more.
Yeah, I don't, oh man, I'd love to say that, yeah, I think that will improve 20 to 40%. I'm totally making that up. Yeah, I think it's going to be that way. I still think that there is a large section of society around the world that would prefer to be told what to do, how to do, when to do it.
Yeah,
No wrong or right there, but I do believe that is the case. And therefore, they're not going to step off their pedestal. And I also believe that there's, 20, 30% of the people, I probably fall in the category myself, that I don't like being told what to do, how to do. I want to be able to figure it out myself. So I kind of have, I kind of am driving my own narrative as well. I'm not naive to that. I'd love to see people taking action. I'd love to see people stepping up and becoming a stronger version of themselves on a regular basis. And I know that's a narrative as well. So I get that. And then I think there's this middle ground of about 40% of the population that could go either way. And that's the group that we're trying to, that's the part I'm trying to swing into my own personal narrative of, listen, let's step up. Let's take action. Let's let the action be the medicine. Let's become the best version of ourselves. And every time we do it, life just gets better. It just improves.
So true. With or without a virus, life improves.
Yeah. We're not done with viruses, right? I think everyone knows there's something else coming, right? Like, I don't know what it is, but now we have nothing else. We're trained.
A 5-minute break in between.
Yeah.
Right. All right, cool. All right, we've got a question here on Facebook. My sodium level was low yesterday when I had blood work for rotor cuff surgery, which I had to cancel until it improves. Any thoughts on when it might stabilize? I have been on the cleanse for 7 days and successfully lost 6.8 pounds, by the way.
Wow, beautiful. Congratulations for taking action there. That's awesome. I love it. That's super good. So sodium is, again, that's part of the electrolytes. So sodium, potassium, magnesium, chloride. Those are the primaries there. And there's one more other there. Anyway, sodium, typically, if I just see sodium stand alone and it's just a little bit low, usually I'll chalk it up to a little bit of dehydration.
Yeah. Okay.
In the event that sodium is low, quite frankly, one of the easiest ways to bring it up is healthy electrolytes. One of the simplest, broadest electrolyte is sea salt, which has naturally occurring sodium in it. So I'd prefer that would be that way. If you literally just want to get your sodium up, sea salt things. So a 1/4 teaspoon will probably get you, I'm trying to go by memory here, about 500 milligrams of sodium. So because it's about a tablespoon is almost 2,000 milligrams of sodium. And when it's bound to the others, you're bringing it in a safe and effective way. So you're not getting too high and too low. So that's one way to do it, to bring it up. It's never something that I'm super concerned. Now, if I saw that marker significantly low, normally that number should be around, Karen, I think it's around 125, 135 on the lab tests. And if it was low, like, under 100, it could be because some of the reasons that I'll see low sodium is because of medications. I'll see it because someone's gone through, they've been vomiting, and possibly there's like an ongoing case of diarrhea. Those are the things that might create that, but typically I'll see it and list a little bit of dehydration. But if they need to get it up and they want to get it up safe, sea salt, great. Sea kelp, pretty good. Like if you can get some sea kelp in your life, which is cleanse friendly. Beet greens are good. Okay. I don't know where you get those, but those are another source of a good healthy source of sodium. So that's where I would start right there.
Yeah. Okay. Awesome. Just on what we were talking about before, we've got a question about what is the Joe Rogan podcast title you were referring to?
So there's two there's Dr. McClellan. It's MCCLOU something
From
like
McCullough,
that.
isn't it? Peter McCullough.
Yeah, Peter McCullough, and then Dr. Robert Malone.
Yeah. So if you just look up Joe Rogan podcast, Dr. Peter McCullough, it'll come up. It comes up really easy in the search.
Yeah, I think that.
We'll go to Spotify or any of your podcast titles. You'll see his podcast there.
Yeah, and I think that one now is over 50 million views.
Peter McCullough.
Yeah.
There's a lot of people. He's getting some people on his podcast with definitely some impressive credentials. A lot of generally mainstream people talking about
some of the more some of the more intelligent, people
Yeah.
in the world when it comes to these topics here. So it's nice to see.
Yeah, no, that's awesome. Okay, next question here. What is the difference between traditional and allopathic medicine?
That's a good question.
What are
So
the main differences?
there's so many differences, Karen, yet, and this comes up a lot every year during the cleanse.
And what do we mean by traditional and allopathic?
So let's traditional and allopathic. We're going to put that together. That is really what we see in our healthcare system. And that is the system of treating symptoms. Flip that over to, say traditional, or if you want to call it allopathic versus holistic. In a holistic way, the goal is that we're looking for root causes. Okay. Root causes of the system, the sickness, the disease, whatever it may be. Now, you would think, doesn't everyone look for the root cause? And unfortunately, the answer is no. Very blatantly, it's a big no. So I'll give you probably the most obvious answer. There's probably 2, 3 that will make you go, you're right. We're not looking for the root causes here. We are treating the symptoms. Cancer is one of them.
Yeah.
So if we were looking for the root cause of cancer, we would be studying and treating people through diet. We'd be treating them through mental health. We'd be treating them, removing toxins. And that's not what we do. We treat cancer. We treat the symptom, which is the actual cancer cell. And that's when we use radiation and chemo. We spend billions treating the symptom. And what's really fascinating, and this is how you can really, really open your eyes to it. There's no wrong or right here. And I'll try to pull these together in just a moment. In the event someone, say, goes into remission when it comes to cancer, there's no further allocation of lifestyle. There's not going to be, and Karen, I want you to maintain, a low carbohydrate or low sugar diet. I want you to make sure you're exercising 4 days a week. Be certain that you're getting at least 8 hours of sleep. None of the things that inhibit the body from, creating good, productive cells. So in the allopathic system, if the symptom is removed, you are released. So it's a system, it is a symptom-based system. And then it just really a can of worms. And that's one of the reasons, especially here in our country, but I would assume in most major, world, countries, that the problem with that type of healthcare system, that it's not designed for chronic care.
No, amazing for emergency care. Got some of the best. We're in a car accident, the way they sew things back on and sew you back up and bring you back to life is almost magical. Amazing how far we've gotten with medicine in that regard. But chronic disease,
like
I just have no idea.
Yeah, diabetes, heart disease, even cancers. Unfortunately, the system's not designed for it. It's not designed for doctors to really work together and to sit down with patients and talk about, their lifestyles and improve these things. It may take 30 minutes, an hour face-to-face. It's just not designed to that. Now, the holistic part of it, it requires more action upon the patient. Yeah, it really does. And I'd never kid anyone. Say, you're going to have to take more action personally when you work with someone like myself, or, another man or woman who does functional medicine, they're doing anything, chiropractic care, you're going to have to take a fair amount more action. There's not just a red or blue pill kind of thing. So, and again, there's no wrong or rights, but understanding those differences, I think, becomes more and more important, like understanding what is the difference. So, for example, if you're in a system removal, healthcare system, if you apply treatment A and it doesn't work, they just go stronger to B, stronger to C, stronger to D. And the cost of that, meaning the human cost, the health cost, is just always part of the formula. And we see things, unfortunately, like chemo and stuff, like if this one didn't work, we'll try this one, knowing that there's a cost, and that cost could be the individual's life. Usually when we look at the holistic approach to it, we're always pushing the envelope saying, how much more will you do? Back to that question that we're going to say is tonight's question. What can I do? And the theory, the concept of stacking healthy habits. I start walking today. I cut out gluten tomorrow. I start doing mantra the following day. Then I get a little meditation in. Then I went from walking, I get to the gym twice a week. And you start stacking these little health. That's holistic care. That is taking the whole mind, body, the whole, how you move, how you eat, and you think, all of it together. And I can go on literally on and on and on how many situations. And the ones that I want to be really mindful, if you guys are listening, so everyone listening here, again, if you're on recording and listening live to this, if you're on medications, if you are doing something like that, just ask yourself, do I know why I'm on this? What does it do? Yes. This is an important question.
What does it do? What actually is this medicine doing?
Yeah. What does it do? And listen, I think it's fair because I get asked every day, doctor, what does this herb do to me? I'm like, you kidding me? You're on 12 drugs. You want to know what ashwagandha does to you? Like, so, and I get it, but it's important. If you're on something for your stomach, like you're on Pepcid or you're on, something else that's out there, ask. And sometimes you would probably be surprised and think, is that really good for me? Is it really good for me to, a proton pump inhibitor? Is it really good for me to be on something that shuts down my natural production of stomach acid? Well, what happens if I eat steak? Who's going to break that down? We need to be asking
blood pressure meds. Often they're on 3, 4, 5.
And we should be asking,
how do they interact?
That's a whole nother can. So, and I think if you're listening, ask yourself that question. And then the other question is, are you getting better or worse? Are you just removing the symptom, or are you getting your body healthier and stronger? And listen, there is no doubt about it, a time for symptom relief with a bigger strategy. Saying, hey, take this for the moment, take this pain reliever, get you through the next 2-3 days as your body's healing up from this surgery, healing up from an injury, whatever it may be. And then let's help restore function back to blah, blah, blah. Gallbladder is a great example. When the gallbladder gets so full of stuff and it gets so overwhelmed that it gets sludgy, eventually there's pain and significant pain. But the problem was not that it existed. So meaning that the answer should not be taken out. It should be, how did it get like that? Like what causes these stones? Not just the removal of the stones, but what causes these stones? And those are the questions. So that is, quite frankly, when I think about the future years, I think that's what makes me optimistic. I think people are going to ask more questions. Yeah. And the natural solution, is going to end up sounding something like, well, what can I do? How do I get stronger? How do I get healthier? What's my diet need to look like? How many hours a night should I sleep? And we start to really, I think that we're going to start to really take these things in and be like, okay, I've heard that 8-hour sleep thing. I heard that's been pretty smart. I only get 6. And I think people are going to start to apply and then start to recognize that when we take action, it's medicinal.
Yeah, for sure. Yeah, awesome. Well, following on from that, kind of our next question here is, how do you start to build your immune system? Is there one way to build your immune system? That's
an entire talk by itself. I'll answer like that. I'll give a simple, probably unexpected answer to that. If I had the opportunity, say I had 500 people, and I was given the opportunity, said you can only give all of these people one thing, like one supplement or one medication, and I wanted to get the absolute best results for them to get healthier. Let's say I don't even know what the 500 symptoms are the 500 people have, but I want to get 500 people healthier overnight. What's the one thing? And I don't think anyone's going to guess what I'm going to say right now.
No, yeah.
There is one thing that would improve the health of every single person, most likely, and that's give them a digestive enzyme.
Yeah, crazy.
Literally, I know that sounds crazy.
Such a big impact.
Absolutely. And there's a couple of reasons. So listen, our stomach, the strength of our acid in our stomach is what fights viruses. It's what fights bacteria. It's what fights parasites. If you cannot break down your food, you can't be strong. You can't be healthy. You don't get enough nutrients. You don't get enough protein. You do not get enough of good, healthy fats. If you don't get the good, healthy fats, your body has to make more cholesterol. So just strengthening your upper GI system. I use something called Zypan. If I could pass out Zypan to the world, I would.
And can anybody take Zypan? Is there anybody that can't?
If you have a stomach ulcer or a mouth ulcer, you can't take it.
Okay.
You could take it, it'll just hurt because it's a hydrochloric acid. Yeah.
Okay. Any other medications, pregnancy, things like that, people can take it?
Yeah, it's just digestive enzyme. Your body naturally makes it, but everybody's is weak. Everybody's.
So is that an everyday?
Yeah, so you take it before you eat. That's it. You just take it before you eat. Don't eat, don't take it. That's it.
We've got a comment here. Funny, I just popped one into my mouth. High five, Carla. That's awesome.
Yeah.
Yeah, perfect. And I'll put the link in if anybody else wants to get it. Dosage,
1 or 2 before meals.
Okay.
Yeah.
Before each meal.
Yeah. So like the one would be like, there's not much animal protein, but the more animal protein, the harder it is for your body to break things down. Remember, you probably get more from animal proteins than you do most other foods, but you want to be able, you need more strength to break it down. And if I went deep into this conversation, we can go into what the science has shown us that about by the age you start at 30 years of age, hydrochloric acid production starts to decrease in the human body. Now, I don't believe that's an age dependent thing. I think it's a lifestyle thing. I think that we have poor lifestyles. We eat a lot of processed foods. We're overwhelming our stomachs. We have too many medications, too many drugs, too much alcohol, all those things that are inhibiting good stomach function. But if you improve we hear all the talk about, I get it. And I talk about it all the time too, microbiome and gut health, but it all starts above it. It starts in your stomach. If you break it down properly, your gut is going to be much better. One of the secret weapons, it's really secret. I'm sure some people that are doing our cleanse are listening. In your Diaplex pills that you're taking 15 of a day right now, there's Zypan in every one of those. Yeah.
Oh yeah.
So
okay.
It is, again, one of the reasons that when I talk about this cleanse is rehab for the human, for human health. This is rehab for your digestive system. It is. It's awesome.
Love that. And I mean, does anybody have, can you tell if you've got low stomach acids? Will people notice? I mean, everybody could probably do with taking these?
Everyone would probably do better simply because our stomach acid is getting worse. So if you have bloating, if you have burping, absolutely. If you have a harder time, if you've all of a sudden found yourself not liking red meat or leaning away from it, most likely, Karen, it is because you have weak stomach acids. Because most humans have an affinity toward eating those things because they're fat. They have fats in them, and fats are yummy, and they're fats and proteins. So humans have always been eating, whatever's out on the farm, in God's garden for that matter. So that's one way to show it. If you get heartburn, if you have what you think is acid reflux, typically is because your acid is so weak that you've inhibited. The strong acid will close that valve at the top. If you don't have strong enough acid, it weakens and it starts to open and acid leaks up. And then what do they do, Karen? They'll put you on a proton pump inhibitor and antacid. Yeah. And it's a double whammy. And now perpetually you will be just wanting carbohydrates because bones like the only thing that your body can break down at that point.
Yeah. Yeah. Again, not looking at the cause, right?
Yeah, exactly. So that's one of the difference, like the symptom versus the root cause. And when you start to look at the root cause, part of that conversation is going to have to sound something like, well, what can I do?
What can I do? All right. Okay. Next question here. Can you take too much zinc?
Yes, you can. And I don't know if I've probably talked about this enough, but it is important. So zinc is a metal, right? And we're supposed to, it's a trace mineral. We're supposed to get this in trace amounts.
Yeah.
So the dosing on zinc should be anywhere from about 10 milligrams per day, 10 to 15 milligrams a day, as high as about 50 milligrams.
Okay.
So if someone had Omicron right now, or they know that they're fighting something, I'd bump you up to so we use something called Zinc Chelate, very digestible source of zinc. I'd bump you up to about 5 pills. 6 pills a day for a very short period of time to make sure the body had access to it, but then I pull you back and we, just go back to a couple a day, 1 or 2 a day. So 10, 15, 20 milligrams per day. Some places, some resources tell you up to 50 per day. The challenge, if you take in too much zinc here, it'll create an imbalance in some of your trace minerals, specifically copper. So it'll deplete your copper. So they're synergistic together. And if you get too much of one, it binds all the others and your body eventually eliminates it. And then you end up void of copper. Now we got others. Copper is real important for things like your adrenal glands. So again, we want to be kind of mindful and smart about these things. So we're like D, we can do really high doses, and vitamin C, which is water soluble. I just talked about super high doses, but zinc we got to be mindful of. And so the side effects of, sometimes they're hard to see, but one of the side effects could be lowering iron levels.
Okay.
Yeah. So again, remember, it's going to bind to the other trace minerals. It can lower copper levels, and that could like lead to some adrenal issues. It could lower iron levels. And, if you're a cycling woman, that's the last thing you want, anything getting rid of more of your iron.
We're all low on iron anyway.
Yeah. And then even it's odd. We've seen some studies show that too much zinc can cause a depletion of your good cholesterols, like the HDLs. Okay. It'll lower those as well. So just be mindful. And the cool thing is that if you think you've taken too much, go off for a couple of days, and your body will naturally, go off it. Yeah. Just come off it for a little bit, a week, 5 days, 7 days, 10 days at a time, and your body will balance it back out.
Can you test those things, or should you test those things?
I don't typically test those, Karen. We have what's called a zinc test. It's a liquid test, and it's really by taste. So it does have,
I've done that. Yeah.
And it's very accurate to see if you have adequate amounts of zinc. So I really like that test. If you came in and it was super, super strong, that might be like, all right, maybe I don't need as much as I'm taking. But most people that with the zinc solution that we have don't even taste it.
Yeah. Okay.
Awesome. Yeah. Meaning their zinc receptors are basically shut down.
So what about D and C? Should we test those?
D, absolutely. Absolutely, positively. This is a no-brainer at this point, especially, here in the States, we're in the winter. If you don't know where your D levels are, check them, because it might be an eye opener for you. Karen, I think there's a $60 test that we have. You can do it at home. We can send it to you. You can come by the office, pick it up, you prick your finger, set it in, and get results. It is one of those ones with that investment is significant. If you're low in vitamin D, under 50 mLs, anything.
Yeah, you put yourself at risk of everything.
Really, hormone imbalance, immune defense, so energy levels, depression, so many things. There are D receptors on just about every cell in the human body, which means you need a lot for a lot of different functions. So that's one of the ways we look at it. That was the discovery years ago. We're like, wow, there's a vitamin D receptor on all these cells, on all these different organs. Why? Because it plays a role in everything. So being deficient in it can have an impact on just about any part of your life.
So people can just write in, send you guys an email, and you'll send them out a test if they do want to do vitamin D test?
Easy breezy, yes.
Okay, awesome. And okay, we've just about the back to the stomach acid really quick, because this is awesome. We've got a comment here. My mama came off a proton pump inhibitor that she'd been on for years simply by taking apple cider vinegar in water every day. I'm so proud of her. She had lost the desire to eat red meat.
Yeah, I'm proud of her too. And I love hearing those stories. I can listen to them all day long. And I've been blessed enough to hear them all the time. And so your mom has changed her life, and she probably forgot the reason she was even on that proton pump inhibitor, and probably stopped even having doctor visits to find out if it was the right thing. So, however, she ended up choosing to do that. She bought a bottle of apple cider vinegar at the store that probably cost her $4.99. It lasts her a month at a time, and she changed her life. So that is absolutely awesome.
So awesome. I love it. What about if you tend to have too much iron? Could taking 30 grams, maybe milligrams of zinc help?
That would not be the strategy I would use, because remember, those are trace minerals and they will bind others as well. Like I said, you could end up being low in copper, and that's really not what you want. That's not the strategy. If you have too much iron by itself is another significant challenge. Fatigue, muscle, pain, a lot of different things having too much iron can cause. I rarely ever see this in women unless they're taking iron tablets, iron injections. No to both of those. I use like a plant-based type of iron called Femax, and there's another one called Ferrofood. Very gentle, very easy for the body to absorb. in the event you have too much iron and you've had it tested, you go give blood. That's what you got to do. Yeah. Go give blood. That's the best way to lower it. You're going to get it out of your body and then just kind of start fresh.
Yeah. Awesome. Further to that comment before, it was our guest here watching you every week and learning from you encouraged me to encourage and educate her to come off the proton pump inhibitors. So thank you. So that's what we do it for. Yeah.
Well, thank you for sharing this. Thank you for sharing that. It's awesome. And that's what action's all about, right? So something got you to take, so this is the power of action. So something motivated me to take action to start my first podcast, right?
Yeah.
I didn't know how to do podcasts. I didn't know anything about it, right? We had to like buy equipment. So something did it. So then it becomes medicinal because you just take the action. The ones that we're afraid of the most, like so worried that we're not going to do it right, those are the ones that you got to take action on. So I do this, and then somehow you get on here, and the young girl that I think is a young girl that was just sharing the story, she gets on here and she starts taking action, and then she spreads the love. So that's why I'm optimistic about next year. That right there. Because I think we're going to see more and more and more of that, which means that we're going to need more and more educated people. We're going to need more and more practitioners. We're going to need more and more personal trainers. We're going to need more and more yoga instructors. We're going to need all of that because people are going to be thinking, man, what can I do? What else can I do? How do I get healthier? How do I get stronger? How do I get closer to being superhuman?
Yeah, 100%. Would you recommend giving blood for anything else besides high iron levels?
Yeah, there are some markers sometimes that I see if like, I don't want to get too deep into it, but like if your hemoglobin shows up too high and basically means your red blood cells are full and they can't absorb anymore, give blood. Yeah. So there's a couple different
people too. I mean, giving blood's a great thing to do anyway, right?
It really is. So, and I find just in general, like we have a lot of blood to give. So giving it.
People need, I mean, that's that bit of the medical system that often works well. Someone's in a big car accident, blood transfusions are.
Yeah. And unfortunately, the blood banks are so significantly depleted right now. So if you feel like got a little extra blood to give, go do it. So it's been a little bit since I've gave blood. I probably, I don't know, about 8 months to a year.
Me too. I used to go a bit more regular. I got to get my iron back up. Every now and again, it goes down. They don't let you take it. I got to get it back up before they'll let me give blood again. But they test that when you go to give blood.
Yeah, and most guys will never have that issue. Most guys, if anything,
guys probably don't.
No, most guys, if anything, we're having too much blood, and oftentimes it's this hidden cause of fatigue. Yeah. Significant.
Awesome. So there you go. Good thing to do all around.
Karen, just a little side note, I don't run out of time, but for many years, there's a big push to use those iron skillets to cook in. I have one, and we're taking on a lot of iron with them. Wow.
Yeah. Interesting.
Yeah.
Cool. All right. Well, as you said, we're running out of time. So although we've kind of discussed our answer, what is going to be our one action that our listeners take to move them towards their goal of becoming superhuman?
Yeah. Ask yourself the question, what can I do?
What can I do? Keep leveling myself up. What can I do for this situation? How can I take imperfect action, right?
Yeah. I think it's a great question. I think it's perfect timing. And again, I want to salute everyone that's spending a little time with us here. Appreciate you guys. Keep sharing it out. Keep spreading the love. And and we'll cover any topic you guys want us to cover. I appreciate you guys doing what you're doing and spending an hour with us every Tuesday night. That's absolutely awesome. And if you're listening,
and inspiring others.
Yeah. It's amazing. And if you're listening to this on a replay, thanks for being here. And we're looking forward to an awesome year. And we've got some other really cool things on the way. So stay tuned.
Awesome. Love it. All right. Well, thanks so much again, guys. I will see you same place, same time next week for another episode of the Health Made Simple show.
And of course, continue to take deliberate action for your mind, your body, overall wellness. You'll be awesome.